Hi guys, welcome back to my channel. I am filming from outdoors. I'm in my yard and it's such a beautiful day, so I'm like, let's just do this outdoors and see how it goes. So today I want to talk a little bit about my pregnancy and delivery experience. I'm a first-time mom and I had my baby here in Canada, London, Ontario. I just want to talk a little bit about my experience, especially why I opted for a midwife versus an OBGYN, a physician. I went with a midwife and I wanted to just share that experience and talk to you guys a little bit about that, just to educate those who are trying to decide if they want to use a midwife or go with a physician, and for those who are wondering what the differences are and things like that.
It was so sunny, I had to switch spots, so I'm in the front of the house now. It was way too sunny.
So I want to start by just talking a bit about educational training, educational requirements. Oops. So midwives in Ontario specifically are very different from how the term midwife is used across like other countries. So in Ontario, a midwife is not a nurse, a midwife is not a doctor. A midwife is a distinct profession of its own, and midwives specialize in low-risk pregnancy and delivery. So midwives go, in terms of education requirements, they go to uni, and it's usually a 4-year baccalaureate degree, a bachelor's degree. What else did I want to say? So midwives are able to deliver babies in the home setting. So a midwife can come to your home and actually help you deliver your baby right in your home. Midwives also do support deliveries in the clinic or in the hospital as well. So when I started my pregnancy journey, initially I was seeing my family physician, and after a couple of weeks, the plan was that she was going to transfer my care over to an OBGYN as the pregnancy progressed. But I've always known that I wanted a midwife, but I didn't know that from the second you know you're pregnant, after you thank God and find out you're pregnant, you can actually pick up your phone and call your midwife right away. So my care initially started with my family physician, and then I transferred over to a midwife. In Ontario, you have to have either or, you can't have both. You can't really be seen by a midwife and your physician. That's like double dipping in the healthcare system. So usually one healthcare professional is in charge at a time. I think some of the highlights for me that really made me very thankful that I opted for a midwife was just the care I received. So as most of you know, when you go for appointments with doctors kind of rush. That's my opinion. Now you could disagree with me, but I'm speaking from my own experience. I feel that most times doctors kind of rush things, and they're with you for maybe 20 minutes or less. And if you don't have any questions and they have nothing to ask you, they just kind of tick boxes and make sure they ask you all the pre-selected questions. But I felt like with my midwife, our appointments were usually 30 minutes, and sometimes it ran up to an hour because it was so thorough. Like, we went through every single scenario you could think of, even things that I wasn't even aware of. Like, she was asking so many questions, ensuring that I have the proper knowledge to make the right decisions, and it was just very thorough. It was never rushed. Like, I left my appointment feeling like I was listened to, feeling heard, feeling that all my concerns were addressed, and feeling more knowledgeable and just even more comfortable and confident about the D-Day, which is delivery day. The other thing is, during my pregnancy, I had my morning sickness extended past the first trimester, so I was very sick, and there are times when I actually ended up at the emergency room because I was so dehydrated. There was one time I actually threw up the whole night. From like all night I was throwing up, and I ended up going to emerge because I was concerned about dehydration because I couldn't keep food or fluids in. And when I went to emerge, I had to wait for long periods, and I was given a bed, and then I waited even for longer, just to see a physician. And when I finally saw a physician afterwards, they ran some tests, and when they found out all my blood work was within normal limits, my brothers and sisters, they said I should go and sit down in the chair in one corner. Me, a pregnant woman, they said go and sit down in the corner, we need our bed for other people. So in other words, my case wasn't so urgent, so the bed was reserved for other people. That's how I sat down in chair for like close to 1 to 2 hours while they were observing me. I was pretty much sitting down in a chair by the hallway. But I remember when I had switched over to my midwife, and I was kind of telling her, oh, there was a period when I had to go to emerge because I was throwing up, and she was like, oh, she wished that I had started seeing her earlier, because I could have just come into the clinic and she could have given me IV fluids in a very comfortable environment and things like that. I'm like, really? Guys, think about it. Instead of me having to go to emerge, spending hours and hours waiting and being seen by people who don't even know you, who don't know your history, especially during the pandemic, everybody was so scared, right? I could have just gone to my midwife. She knew me, she knew my history. I could get my IV fluids and just receive like VIP treatment. Yes. The other thing, when I had to do blood work, my physician would give me my prescription, so I would go to a lab and get my blood drawn. With my midwife, she would draw my blood there, and then I would go for my appointment. She would draw blood. I would do my urine test. Everything was done in one place. I didn't have to start going here and going there for other treatment. It was just so amazing. The other thing I really liked about a midwife was also how I felt that with my midwife, so midwives are more holistic in their approach, and so many times they would not push for unnecessary medical diagnostics and things that they don't consider very important. If there are tests and different things that they don't think is that relevant to you, and they think is optional, they would present you with that choice to decide if you wanted to go for that test or not. I mean, for something very critical and important, they would definitely highly recommend that you do it. But if it was something that wasn't really relevant to you or didn't really concern you based on your low risk factor, they wouldn't push for those medical things. So they are really more holistic and treat you as a whole person. They're not very medical in their approach. The other thing that stood out to me was, I went past my due date, and I think I was almost 40. I was 42 weeks and some days before I went into labor. And I think with midwives also, they just really allow the body do its thing. They are not very pushy. As long as your pregnancy is low risk and everything is fine and within normal limits, they're not very pushy. So I remember I kept seeing my midwife like I think twice a week once I went past my due date, and she would check me and we'll talk, and then we came up with a plan that, okay, let's see if the baby and my body starts the whole labor process. But if it doesn't happen, we came up with a plan. But even though I went past the 41 week, I went past 42 weeks, we kind of made a plan, okay, before the 43rd week, we will definitely go in and start an induction. But I didn't feel rushed, I didn't feel pushed. She said, Adobe, everything looks fine, let's just see if your body will start its, do its thing, and the whole labor process will start naturally. And that's what happened. So I went into labor in the middle of the night, and with midwives, there's always somebody on call 24 hours a day, 7 days a week. So I didn't go into labor immediately. My water broke, and I remember paging my midwife. She called me back. I told her what was happening, and she's like, okay, seems like your water broke. She's like, make sure you get a towel, sit on a towel, so because the water is going to just keep dribbling. And she told me that, asked me about my contractions. Am I having contractions? How often are they happening? We just had like a whole discussion about what was going on, what was happening with my body. And then we decided to wait a few more hours, and she advised that I get some rest. and look at me feeling like, no, I think I'm strong, I'm ready. She's like, Adobe, it's gonna be a long day, so go get some rest, try and rest, eat light food and just try and relax. If anything changes or you start feeling uncomfortable or anything, she pretty much told me what to look out for. Told me to page her if anything was off. So that happened. We decided to go in for induction, I want to say 9 to 10 hours later after my water broke, because my contractions were not very strong and were not very steady. So we decided to go in for an induction. When we went in for the induction, she was already at the hospital waiting for me, and my midwife stayed with me throughout the whole process. I think she left my side. She left the room maybe once or twice to go use the washroom. Aside from that, she was with me the whole time. I remember I was kind of asking, I asked her, wouldn't she take a break and just go get something to eat and rest a little bit? She's like, no, I'm gonna be with you all the way. So she pretty much stayed with me, stayed in the room with me by my side throughout the whole delivery process. I also felt that because prior to me going into labor, we had talked about getting an epidural or not. And when we had talked about it, we both kind of decided on we made a plan based on what I wanted. And what I wanted was, I wanted to try and see if I could have the baby without epidural. But if I got to that point where I felt exhausted and I just couldn't control the pain with other non-pharmacological approaches, then I would request an epidural. And I was really happy that when it came on the due day, which is delivery day, she really respected the plan we came up with. She kept helping me manage my pain using different techniques that we had talked about and discussed, and she really wasn't really pushy and saying get an epidural. She worked with me, and when it got to the point where I was really exhausted and I think I needed an epidural because I just couldn't manage the pain anymore, immediately I requested for an epidural. She was very prompt about reaching out to the anesthesiologist and having them give me the epidural. Another thing I really liked about my midwife was there was a time when things were not progressing the way they should, but she really was patient with me. It wasn't like, okay, you're dilating too slowly, you're not going as fast as we want you to go, let's go get a C-section. She really was patient with me, understanding that I'm a first-time mom. It was my first time being pregnant, so she really worked with me. And she was very patient. She supported my plan the whole way, and so my epidural, it took a while for the epidural to kick in. Like, it took longer than usual for the epidural to kick in, and then when it kicked in, I think it was effective for about 90 minutes, and after 90 minutes my epidural just failed, like it stopped working. And I remember when I started to feel like I was getting my sensation back, I was kind of telling the nurses and the doctors, because they had come into my room because of the epidural. Aside from that, I only had the midwife in my room. I remember telling the nurses and telling the anesthesiologist that I think the epidural is failing. I'm starting to have sensations, but again, these doctors and nurses, by the time they realized that I was making sense and the epidural was failing, at this point the epidural has completely stopped working. All the labor pain and all the sensation and everything has returned 100%. So I was in agony, I was in so much pain. And then the anesthesiologist suggested a particular type of pain medication, and my midwife just immediately started advocating for me, and she said, she gave her opinion. She was just like, I don't think Adobe should get this for this and this reason. Like, she was advocating for me and telling the anesthesiologist that she doesn't think that is the proper pain management option for me at that time. And I really liked that, because at that point I was in so much pain that, and my husband is not really a medical person, and I was in so much pain that I really didn't think through what the anesthesiologist was telling me. But I was so happy that my midwife just jumped in and began to advocate for me and speak up on my behalf, and she suggested other things that we ended up doing and had a more positive outcome. So after I was fully dilated, prior to the delivery, a second midwife arrived. That way, after the birth of my baby, my midwife could continue to concentrate on me, and the other midwife would concentrate on the baby. After the birth, we rested, and then I think 12 hours later, or even less than, my midwife returned back to meet me at the hospital just to check on me once again. And then pretty much she said, Adobe, everything is fine, and she discharged me. So I had my baby like 12:00 something, and I was discharged, so 12:00 something in the morning, and I was discharged like maybe by 3 or 4 p.m. that same day in the evening. I remember people like, you left the hospital already? But yeah, my midwife didn't see any reason to keep me in the hospital because everything looked fine. There was no cause for concern, so I was discharged and I came home. And then that kind of ends my delivery experience. Moving on to my postpartum experience. So postpartum is after I've had the baby. I really loved that midwife home call. So the midwives will come to your home to see you and the baby right after delivery. If you were seeing an OBGYN, you would have to carry your child and go for your appointments like the next day after you just had a baby. See, anybody who just had a baby, nobody wants to leave the house or start entering car and driving around for appointments. You just want to be relaxed and just stay home and just enjoy your baby and heal and rest. So it was really nice to have my midwife come to my home and do her assessments. I think for the first 3 days she would come to the home and see me and the baby, and I think after the 3rd day then I started going to see her in the clinic. So just having those home calls was so amazing. And when she came to my home, all the newborn tests and things that had to be done, she did it right in my home, in my living room, and I just had to stay in my pajamas, and she came, and it was just a wonderful experience. So for couples out there, if you are pregnant and it's a low risk pregnancy and there's really no cause for concerns, I would highly recommend using a midwife. I find that midwives are just more holistic. They work with you, they're patient, and it's just overall, it's just an amazing level of care you get. So guys, I think that's all I have to say. If you have any questions or thoughts you want to share, please leave them in the comment section. Thank you so much for spending this time with me. Do not forget to like, share, subscribe, and hit the notification bell for more amazing videos. Other than that, bye. I'll see you guys next time.